Welcome. This video is to give you an overview of telemental health. Certainly not to provide you a full training, but to expose you to what the competencies are in regards to providing telemental health services. My name's Ray Barrett. I'm the owner of the Telehealth Certification Institute. I'm also the instructor for the courses that we provide. I'll tell you a little bit about myself. I'm a licensed mental health professional in New York State, and I first started providing telemental health services as soon as I started up my private practice approximately 10 years ago. So after completing my graduate program and my supervised training, I thought, hey, I'm ready to do this, right? And my first client that called me seeking services actually wanted counseling over the phone. So I thought, hey, that was really interesting. I would enjoy working from home, but very quickly realized I didn't learn anything about that in my graduate program. Like, how do I verify identity? How do I even collect payment from this person when they're not coming to my office? Or how do I register them? Are there any ethics or legalities involved? So I sought out answers to my questions, and the more that I learned, the more questions that I had. At that time, one thing that I found was best practices that were provided through the National Board for Certified Counselors. They actually published best practices on distance counseling over 20 years ago, and they've had a credential in telemental health for about 14 years. So that was helpful, but I also realized that there was a lot of questions that I had that I really struggled finding answers to. So eventually, I ended up developing a training. But while providing telemental health services, people, in my area knew that that's what I was providing. So an EAP program that served a chain of gas stations reached out to me to see if I would provide that service for their clients, because kind of crazy things happen at night at gas stations, and it's usually young people that work there. Even the managers are young. So they don't necessarily seek out counseling or professional when a traumatic event happens. So we simply met them where they are, which is their cell phone, right? Everyone always has their cell phone on them. So I would call and do a debriefing, triage, and offer ongoing services to them. I was also providing executive coaching at the time. So they asked me to provide executive coaching for the managers at the different branches, which I did. Through conference calls. So I would meet approximately 11 managers at a time through a conference call. Then I also began providing mobile assessment, where I would drive to different hospitals providing mental health assessments, and urgent care clinics and PCP's offices, but mostly hospitals. Well, one of the hospitals that contracted with this company decided to do it on their own, but they wanted to do it through telehealth. And knowing that that's what I provided, they reached out to me, and I was part of the process of, I got to test out a couple different technologies, and got to be a little bit of a part of the process of how documentations were sent. So I provided that service actually from another state for 3 years. So I had some really good experiences providing telemental health. And then I began providing trainings and consultations to private practices and organizations on telehealth. So let's get started. To do so, let me share some PowerPoint slides here. So again, this is just an overview, and I am with the Telehealth Certification Institute. So the first thing is, what is telemental health? And it's exactly what you probably think it is. It's providing services to a client when you and the client are not at the same location and you're using technology to communicate. So one thing to recognize here is that it's not a separate service. It's not like you have mental health service and then you have telemental health. It's simply mental health or behavioral health services, but provided through the use of technology. So I point out the American Telemedicine Association here because if you're involved in telehealth, they will probably be one of your best resources. It's a nonprofit organization where healthcare providers of all different fields of healthcare get together to collaborate on telehealth. So they provide advocacy, they establish best practices, they provide trainings, they track legislation throughout all of the 50 states in the United States, they track reimbursement. They have a resource page on the nomenclature, so the terminology around telehealth. They do a lot of great stuff. They have a lot of different subgroups and forums. So like one of the groups I'm involved in is the Telemental Health group. They have a monthly conference call meeting. You'll get forum posts. I get forum posts on a daily basis from the American Telemedicine Association. So it's a great way to keep up with recent trends in telemental health. So why is telemental health important? Why do we care about it? Why is the federal government investing a significant amount of money into telehealth? And again, you probably know a lot of the answers to this. You've probably come across this, where clients live in a rural area, where they don't have access to a behavioral health professional, or getting an appointment is going to take quite some time, or they have to travel, or they might know people that work at the office and they don't want to be involved in dual relationships and they're concerned about their confidentiality, or it's a real burden to them to get to the appointment due to medical issues, transportation issues. And then a lot of clients just simply want the convenience of telemental health, or clients might be looking for a specialist and they can't find one in their area. So telehealth greatly overcomes those barriers. It's also very helpful for the clinician themselves due to the convenience and flexibility of providing services. So there's benefits to the community, benefits to individual clients, and to the providers. And I can give you many, many use cases in regards to actually providing services to clients and why it's beneficial. But due to sake of time, I can't do that now. But let me point out that telemental health is also very helpful for care coordination, for receiving consultation from other providers or providing consultation to them. It's helpful for working with groups and couples, for education of clinicians and clients themselves. So to give you some research on this, first of all, the federal government provides a map of the designated mental health provider shortage areas in our country, and you'd be surprised how much of the country is a shortage area for mental health providers. But also our government does a survey every year on mental health. It's part of the National Survey on Drug Use and Health. So these are the 2013 findings, and they're pretty consistent year to year. But about 19% of those of adults that have any mental health illness perceive that they didn't receive the care that they needed that year. So my question is, well, why? Why is it that those with mental health issues in our country do not receive the care that they need? So these are the reasons why. I didn't leave any out. And to me, it was pretty clear as to how telemental health helps overcome these barriers. So for many, 55%, they thought that they couldn't afford it. About 25% didn't know where to go for services. Some didn't have transportation. Many of them, it was because they were concerned about confidentiality. So many of these categories have to do with confidentiality. In terms of not wanting to have an impact on their job or their neighbors finding out and so forth. And then also for a portion of them, it was because they didn't have time. It takes on average, I believe I saw a statistic of about 50 minutes round trip travel time for a patient to see a healthcare provider in our country. All right, and in terms of research, just to give it kind of in a nutshell. Now, in the trainings that we provide, we go over all of these aspects of telemental health at length. But just to touch on it, a meta-analysis of 92 studies. So a meta-analysis is running a regression analysis on the results of studies that have already been conducted. So this meta-analysis shows that telemental health is just as effective as when the client and the clinician are in the same room as one another. And then, so that's results. In terms of retention, retention is important because psychotherapy only works if it takes place, right? Surprise, surprise. So there was a research study done on phone counseling, and those that received phone counseling stuck with it longer than when they had to go to the office. Again, not a surprise because of the convenience. Clients and clinicians are both satisfied with telemental health, and they are certainly able to, clinicians and clients are certainly able to develop rapport with one another and communicate effectively. There's a lot of research on telehealth in general and specifically telemental health. So now moving on to the benefits, we ought to know what are the benefits and what are the drawbacks. So the benefits, again, is that it overcomes obstacles to receiving treatment in the first place. And also, some clients prefer to communicate through video conferencing or phone or text-based. Everyone has their own preferred style of communication and means of communication, and that varies day to day sometimes. So one day you might want to see someone in the same room as them, right? Another day you might want to talk to them on the phone. And it depends on what you need. So the flexibility has been very, very helpful. And then in regards to care coordination is extremely helpful to healthcare in general in our nation. It reduces medication errors, it improves the diagnosis and treatment plan, it reduces unnecessary readmission rates and medication errors. So it's very, very helpful to us, and especially in terms of education, like you're receiving right now. You didn't have to come to my office to receive this information. You're just doing it through your computer. Now, the drawbacks, one thing to think about here is, what are the actual differences between providing mental health services through the use of technology when you and the client are at separate locations versus when they come to your office? So yes, of course, when you're using technology, at least as of now, you can't smell them, you can't touch them, you might not see them enter the room and how they walk or their gait. So those are pretty obvious. And then technology itself could have issues, right? Especially on the client's end, if they are at like their own location and relying on their own technology, they might not have very good internet speed or processing speed of their devices. They might have interruptions. There might be issues with security and privacy. So a lot of these issues happen also when a client comes to an office where the clinician has more control over it. But it's important to be aware of what these drawbacks are so that you can try to avoid them and mitigate them and prepare for them, such as how do you help a client when they're having a technology issue and what are your backup plans and so forth. So these are things that we go over, in a full training. So now I'm going to move on to compliance, legally and ethically. So we're going to cover HIPAA compliance. HIPAA is privacy law in the United States of America. And then you have licensure law in the United States and ethical guidelines that are passed down from licensing boards and professional associations and standards of practice. So again, HIPAA has to do with protecting the privacy of patients' healthcare information in the United States of America. That's what it has to do with. Now, being a mental health care provider, that's very important to me. The first thing that I go over when I see a client for the first time is information about how I protect their privacy. right? Which is confidentiality. It's very important to clients, especially with mental health care services. So HIPAA helps us back that up. It educates us and it requires things from us that really helps mitigate the risk of an unintended person getting access to our client's information. So the Health Insurance Portability and Accountability Act was put in place in 1996. And then we had the HITECH Act of 2009 during the same time period as the Affordable Care Act. In the Affordable Care Act, by the way, a big part of it was to increase the utilization of technology in the provision of healthcare in our country in order to make our healthcare more affordable and effective. But with the increase of use of technology, we obviously also have a concern about patients' privacy and protecting that. So we have the HITECH Act of 2009 and then the Omnibus Rule of 2013. Becoming HIPAA compliant is quite a significant task. That's why organizations usually hire a HIPAA consultant or they have a HIPAA specialist on staff to assist them with that. So I'm just going to kind of touch upon these things. And again, I definitely recommend that you get a full training on this. Now, are you required to comply to HIPAA law? Well, those that are legally bound to HIPAA law are called covered entities. They are insurance companies, clearinghouses, and healthcare providers who conduct electronic transactions with insurance companies and clearinghouses. So most healthcare providers are covered entities, some are not. Some state laws require that you adhere to HIPAA even if you're not a covered entity according to HIPAA law itself. And then HIPAA is the standard of care when it comes to protecting patients' privacy. So if you ever were brought to, say, criminal court, civil court, or before a licensing board, often those that are ruling on the judgment as to whether or not you were adhering to standard of care would probably rely on HIPAA to assess that. So it's important that you comply with HIPAA. HIPAA has 4 main rules to it. There's 3 that you really have to concern yourself with quite a bit. And that's the privacy rule, security rule, and breach notification rule. All healthcare providers in our country have to adhere to the privacy rule. Covered entities have to adhere to the security rule and breach notification rule. And we'll get into that a little bit more. All right, so the privacy rule has to do with verbal information about patients that is connected to healthcare, of course, individuals' information that's connected to healthcare, and also information that's on paper, and also the electronic form of information. So it's basically all information, healthcare information that could be linked back to an individual. So protected health information, that's what it is. Protected health information is healthcare information that could be linked back to an individual. And HIPAA law has in it information about how to de-identify information, and in that part of the law, they identify 18 identifiers of PHI. Some of them are a client's name, their address, their email address, their IP address, their phone number, their photo ID, images, stuff like that. So it's our responsibility to protect that information, and in the privacy rule, there's a patient bill of rights that explains to them their rights. So we have to, disclose to clients what's called the Notice of Privacy Policies, which tells them about their Bill of Rights and how we protect their privacy and the instances in which we can disclose their health care information. So we can disclose patient information when it has to do with care coordination, providing clinical services, operations, billing. So that's very much in a nutshell the privacy rule. Now, the security rule and breach notification rule have to do with the electronic form of protected health information, EPHI. You may have seen that in literature. So the security rule requires quite a bit of us. We have to secure the electronic form of information. We have to identify risks. We have to have a risk management plan. We have to have policies and procedures. We have to limit access to patient information to only those that ought to have it electronically. There's the physical, technical, and administrative safeguards that we have to adhere to. We have to ensure the confidentiality, integrity, and availability of the electronic form of protected health information. It's really extensive, and HIPAA compliance is very much an administrative task along with actually doing things in your office and with your technology. So the administrative part is, conducting the risk analysis, having a risk management plan, having policies and procedures, then link back to the privacy rule and security rule and breach notification rule. So I bring this up because HIPAA law has a lot to do with the use of technology in healthcare. Now, sometimes when I do trainings on HIPAA law, those that I train kind of get overwhelmed with the task of HIPAA compliance, and therefore they think, well, gee, I'm not going to do telemental health then. Well, adding telemental health services to your practice or organization actually has very little impact on what's required of you for HIPAA compliance. You have to comply with all of HIPAA law, whether or not you provide telemental health services. But the reason why I train people on it as a part of telemental health training is often clinicians don't really know much about it and have not been trained on it already. And again, like I was saying, it's very important in regards to protecting patients' privacy. So such as sometimes clinicians will send emails to clients, which is not necessarily secure. Or they'll be texting, like regular SMS texting on their phones with clients, which is not considered secure. Or they'll do private messaging on Facebook, or they'll use technology where they don't have a business associate agreement with the technology provider, and the technology provider's not actually adhering to HIPAA. There's many, many examples of how clinicians are putting clients' privacy at risk. So in terms of a business associate agreement, again, like I said, HIPAA law, covered entities have to adhere to HIPAA law, right, legally. Business associates are organizations or individuals that provide a service to a covered entity, and in doing so, they have access to PHI. In situations like that, HIPAA law requires that the covered entity gets a business associate agreement from that business associate, from their organization or individual. When an organization or individual signs a business associate agreement, they voluntarily, legally bind themselves to HIPAA law, which means they have to adhere to HIPAA law just as the covered entity does. So that's very important because say you are a behavioral health professional and you're using electronic health records and you adhere to HIPAA, you are really diligent on protecting your client's privacy. But if the EHR program where you put all of your client's information on is not, that puts your client's privacy greatly at risk. So, and then the business associate subcontractors also have to provide a BAA to that business associate. The chain is only as strong as the weakest link. So anywhere that PHI touches, you want to make sure that it's protected. In terms of computer or device security, we're all using devices these days, smartphones, computers, laptops, tablets, all sorts of things, right? And we're using these in the provision of our healthcare services. So in terms of securing devices, You certainly want to have a firewall turned on, anti-malware, strong passwords. You want to have it backed up. You want to have the full the device full disk encrypted. So there's computer security things that you're going to want to be aware of. Now let's move on to the legal aspects of telemental health. In the United States, and again, you're probably aware of this too, but in the United States, we have federal government and state government with different responsibilities and authority. And in the United States of America, each individual state has the authority to restrict the provision of a service if they choose to. And the way that they often do that is by creating a professional license. So say a state decides, yeah, we want to restrict the provision of mental health services in our state. So what they'll do is they'll write a statute, a licensure law, that defines that license, and then they will have an agency to regulate that license, which is the licensing board, and they'll come up with criteria that is required for someone to get licensed by the licensing board, authorized to provide that service and use that title. And we have Title Acts and Practice Acts. So it's the state's job to protect those people that are physically within the boundaries of their state. That's the jurisdiction, the geographical region that the state has the authority and responsibility to enforce law. So the question with telehealth is, where does the healthcare take place? And you need to know that to know what legal body has the authority to regulate and restrict the service, right? That could be very complicated, and the question would be, well, who has the authority to state where telehealth takes place? Well, it would be the state licensing boards. Some of them do state where telemental health takes place, some do not. Those that do mostly say that it takes place at the location of the client. So the legalities of telemental health and how to address it is very complex for the United States. I definitely recommend that you get a training in telemental health to be able to ensure that you're practicing legally and to navigate that. In a nutshell, if you want to know if you're practicing telehealth legally in the United States of America, you would want to have approval from the licensing board where the client is, where you are, and from the licensing board that provided you a license. But again, I definitely recommend getting training on that. All right, there are some license mobility or portability efforts, because obviously we travel from state to state, we visit different states in the United States. So interstate counseling and the restriction of that is quite a dilemma for us. There are compacts, so like nurses have a great compact. The compact is a third-party organization that will register clinicians, and then state licensing boards can decide to partake in the compact. So like the nursing compact has 26 states. If a nurse is registered with a compact and licensed in any of those 26 states, they could practice in any of those 26 states legally. So counselors, social workers, psychologists, psychiatrists, they all have their own efforts. Counselors, there's 4 professional associations that have gotten together and made a proposal to the state licensing boards to make it easier for counselors to get licensed, to go through the licensure process in those states. It doesn't resolve interstate counseling issues, but it is a first step. Social workers have a website that talks about their efforts. Psychologists have a compact. It is quite limited. All right, so let's look at ethics. A very important topic, right? One thing about ethics that is very important when you're looking at any, say, new modality to you in terms of providing services or technique or style or anything like that, is you're only supposed to practice within the boundaries of your competence. So your license as a behavioral health professional defines a scope of practice. Now, the scope of practice it's like the maximum that you can do, right? So you can do a lot of things under your license, but you're only supposed to do those things, provide those services, if you are competent in doing so. So this is a very bizarre thing to me because, I mean, I truly believe in it and support it, but it's kind of bizarre because I find that people don't know whether or not they're competent unless they've been exposed to what competence is. So that's the purpose of this video, to kind of expose to you what competence looks like and what you ought to be aware of. When I was 13 years old, I thought that I could very competently drive a race car. So the first time I drove, I very quickly found out how incompetent I was. Right? So when it comes to the use of technology in practice, are you competent in using it? I could tell you that as of today, this is 2018, clinicians that I come across often are using technologies that they are not competent in using. So like even look at the cell phone. Like sometimes in my trainings I'll ask people, who here is competent in using the phone for healthcare? And a lot of people raise their hand. I'll say, can I see your phone? And they'll show me their phone. And I'll point out that this mobile phone is like a small computer. It's connected to usually either a Google account or iPhone account, has apps on it, usually has a voicemail app, has contacts, has access a lot of times to EHRs and stuff like that. So knowing how to competently use technology in practice is very important if you're going to use it. We'll get into that more. But another thing within ethical guidelines is informed consent, right? Clients ought to be adequately informed to make a decision as to whether or not to receive services from you. So what do they need to know? Well, they need to know like what the expectations are, what the backup plans, the emergency management plan is, how sessions are conducted, your availability, those kind of things. So if you're going to add telemental health services to your practice, you're likely going to have to adapt your informed consent a bit. And then also, ethically, we should screen for fit, and we should have that emergency management plan. There's several things ethically that we ought to be aware of and competent in before providing telemental health services. And to investigate this, I would recommend that you heavily rely on your professional association, but not just yours. Look at others too, because they have really good things in their codes of ethics and their practice guidelines. So like in the training that we provide, I've looked at all of them. I've looked at all the state licensing boards. I've looked at a lot of professional literature and kind of put the pieces together in terms of what does competence mean. Because what we're talking about is best practices, and who's the authority when it comes to best practice? Well, we certainly rely, again, on professional association, licensing boards, and experts in the field that publish articles and provide research for us. In terms of technology, how do you choose the technology to use? So much telehealth technology is popping up every week. It's really interesting and kind of exciting to see. The technology has certainly improved quite a bit. As a behavioral health professional, again, one thing that's very important is confidentiality. So you certainly only want to use technology that is secure. And part of that is that the technology provider provides a business associate agreement and that you verify that they actually are complying with HIPAA reasonably, right? Reasonably investigate that. And you also want the technology to be very, very easy to use, have very good quality. You want to be able to use it on different browsers and devices in a secure way. And you definitely want to conduct a risk analysis of any technology that you use before you start using it and understand how you eliminate or mitigate those risks when using it. And you should be very competent in using the technology that you choose to use, because say there's a technology crisis, you want to be able to put the client at ease and be able to assist them with that so that their experience of telemental health is really positive, not frustrating, right? And you want to be able to prepare the client. In terms of emergency management plans, there's two basic environments that we have to look at. There are supervised sites and unsupervised sites. And then you have the client's location and the clinician's location. A supervised site is where the client is somewhere where there is a professional available to assist them. The site that they're at on a supervised site has been set up for them. The technology has been verified to be secure and work well and so forth. And someone's there to help them when there's emergencies. So when you are providing services to another supervised site, another clinic, they will have, and you have to verify that they do, have an emergency management plan and make sure that it works and test it out and so forth. And then if the client's at an unsupervised site, you have to establish an emergency management plan for each session and for each location. And there's some things that you fundamentally need to know when creating that emergency management plan. And then also there's customization of the emergency management plan according to the client, their location, their situation. So that's important, and it's not really hard, right? None of this stuff is really hard once you know how to do it and you've done it once or twice, right? Or a few times, right? So getting the training and practicing and testing things out before launching is important, and then moving on from there, it's not that difficult. But it's very important not just to wing it, and having sessions without an emergency management plan is definitely risky business. Now, your site, right, where you're providing services ought to be set up appropriately. So a lot of times, like in our training, we do three formats. We do online self-study trainings, we do on-site trainings, and we do live webinars. For part of the training, I really enjoy doing the live webinar because clinicians actually get to experience providing telemental health and get feedback. So they learn very quickly how to improve their lighting in their room, how to improve their gaze angle, the setup, the design, communication skills through video conferencing. So you want to have a good presentation, and I can just tell you from experience of being on video with many, many, many people, people don't just naturally do that well. They need a little guidance and then feedback and adjustments, and then voila, it looks good, sounds good, right? But there's certainly a little bit of a learning curve there. So again, I just become aware of what video conferencing etiquette is and how to set that up appropriately. And then your clients, they might be technology immigrants or just not be great at technology. They might not have very good technology. So it's important that you prepare them for the session. So again, when they receive telemental health services, it's a very positive, easy, convenient experience, right? So there's different ways to prepare them. You can walk them through it over the phone. You could show them how to do it while they're in your office. You can have a video demonstration on your website or step-by-step process. So there's different ways to prepare them. And then when you meet with them first time, you want to go over the skills of using video conferencing, backup plans, how to use the technology, and so forth. And practice makes perfect. So practice, practice, practice. You could practice with friends and family, other colleagues and stuff like that. and you know, will become comfortable. And I highly suggest that. It's really fun to see in our trainings. A lot of clinicians have never provided telemental health. Most of them have not when they receive a training. And then after doing the live webinar portion and practicing it, because what I do is I break up people into groups of 2 or 3 and they practice different scenarios, and then they come back and then they get sent back again with another scenario. They leave really empowered and feeling much more comfortable. I cannot count the amount of times that I train someone and they at the end of the training, they say, you know what? When I came into this training, I was really reluctant and suspicious of telemental health and not sure how that would work. And now I could see, like, that was great. Like, they really enjoyed it and they could see themselves using it. So practice is important. Some common mistakes, I figure this is important to point out, is sometimes clinicians they'll sign up with a company who either provides telemental health services or they simply make accessible telehealth providers. So clinicians will go on the internet, they'll look up online counseling, they'll see companies out there that have provider profiles available where people could receive services, and they think, hey, this company must know what they're doing. So I'll sign up as a provider or I'll be listed as a provider. And a lot of times that's not a good decision because a lot of times those companies have not set things up in a way that allow you to be compliant with the law and ethics of telemental health. So it's important to know what to look for and how to make those decisions, and just don't go in blindly. There's several things that need to be in place to provide telemental health in a way where you're compliant, which has to do with protecting the client and providing best services. So if you're looking for training, again, we have online self-study programs that are put together very well, live webinars where you can see and hear everyone, they can see and hear you, but you're at your own location, or you can host a training on site where I'll come out and provide a training for you. Often that's a very helpful thing for organizations because it's a good way for them to market to their community also. You could also reach out to us by email or through the website or by giving us a call. So that's it for now, and I hope this was very beneficial to you. If you have questions, feel free to just reach out to me by email or phone. And please pass this forward. If you found this helpful, just send your colleagues a link so they can also get exposed to what this new telehealth stuff is and what they ought to know about before they launch services, so that we as a profession can keep a very good reputation and so clients can have a great experience. So thanks a lot, and to the best to you. Bye-bye.